Hello, my name's Diane Stewart. I'm the Director of the California Quality Collaborative, a multi-stakeholder effort to improve quality and efficiency of healthcare in California. Today we're going to talk about the patient experience. Patient ratings of care have improved slowly over the last 5 years in California, and CQC has worked with a number of physician groups to improve their scores. Today we're going to visit with the Facey Medical Group, who made fairly dramatic improvements in their patient ratings of care after working with CQC. We're going to visit them in Mission Hills in Southern California and find out what they did to improve their patient experience. We're here at Facey Medical Group in Mission Hills, California with Teresa David, the Chief Operating Officer. Thanks for joining us today, Teresa.
Sure.
Why did Facey decide to focus on improving the patient experience?
We knew that we had to focus on improving the patient experience as a burning platform issue for some substantial reasons. First of all, our key competitors had been very much focused on becoming more patient-centric, and we were behind in that regard. Two of our main strategic goals, become the provider of choice, become the employer of choice, would benefit by improving patient satisfaction at Facey. And then we looked at our trended results in the group PAS surveys, and we saw that we always did very well on the clinical performance measures, well above the 75th percentile. And then when we looked at our patient satisfaction scores, we were always below the 25th percentile. And so that dichotomy was not a pleasant thing to view. So we really wanted to tackle the patient experience. Another issue that we considered is perhaps we could pick up more P for P dollars if our patient satisfaction scores improved. And then most importantly, it's the right thing to do to address patient satisfaction.
Could you tell us what kind of improvement you made on your most recent PAS report?
So let me take you back to 2008 when we set our aim for the program. In 2008, on the overall rating of care, Facey was at the 23rd percentile. And then our overall scoring of the PCPs was at the 15th percentile. So we set the lofty goal of trying to achieve the 50th percentile in the overall rating of care. And when we got the results, we were ecstatic. We hit that mark exactly. We achieved the 50th percentile. And then on the overall rating of PCPs, we actually jumped from the 15th percentile to the 75th percentile. And we saw marked improvement in coordination of care and scores related to office staff as well.
Did you see any other changes within your organization as a result?
Absolutely. The good news is that we saw our patient complaint trends declining, while we received many more compliments from patients than in the past. We also really experienced, I think, a cultural shift to really think about the patient first as we made our key decisions. And I think there is a growing sense of esprit de corps between the physicians and staff at the sites, and a greater value on teamwork and customer service throughout the organization.
Well, congratulations, Teresa, and to everyone at Facey Medical Group, because it really does take everyone refocusing on the patient. Maybe you could tell us a little bit about what you did over the last 2 years to achieve those very large jumps in patient ratings.
Sure. First of all, we established a core team that was really responsible for leading the sustained change effort. We knew it was going to be a long haul. So we included 3 high-profile physicians in the medical group, the Director of Quality Management, Director of UM, and a Regional Medical Director. And then we combined forces with the administrative team, COO, Quality Management Director, Site Directors, Customer Service Director. So that was the group that really led the effort. We established that we really wanted to focus on 3 domains: doctor-patient communication, coordination of care, and office staff patient interactions. So for the first 2 domains, we had all of our providers go through a doctor-patient communication training session led by an outside consultant. It was a 4-hour session, and they learned how to use Agenda tool to focus the visit, how to interact with difficult patients, how to establish immediate rapport with that patient despite a 15-minute visit. Once they went through the training, they each established their own AIM statement that identified what behavior changes they wanted to make. They experimented, they got daily feedback through surveys that we did, not for all of the patients, but a subset of the patients. They met frequently, looked at how they were doing. We introduced the concept of doing phone surveys with an outside company. And now we're doing 60 surveys per provider per year, and the providers get feedback through that formalized survey process twice a year. So we are dedicated to giving the providers more real-time feedback. All of the providers also looked at the medical chart before entering the exam room. So they were very current on what was going on with the patient's care, both inside Facey and outside Facey. And then finally, to address the staff-patient interaction issue, we rolled out a series of customer service trainings, actually 3 distinct trainings over the last 3 years, and all of our patient care staff went through the training sessions. And now we're about to embark on our 4th training module. We sent out monthly customer service tips to all of the staff at Facey. We did fun contests, raffle prizes if we noticed that great customer service was happening. And we started the road shows where we'd go out quarterly, including myself. We'd meet with all of the staff at the sites and really center the agenda on good customer service techniques, what's working, what isn't, and get their ideas on how to improve the patient experience.
That's a lot, Teresa. I can see what kind of, just beginning to get a sense of what kind of effort it took here. And we'll have a chance to talk with some of your practicing physicians about what it was like for them to learn these new techniques, and with some of the medical leaders who led the effort in the core group with you. Thank you.
Great.